So we have some breaking news coming into us from one of the most high-profile Senate races in the country right now, and that is the one going down in Pennsylvania. This coming from the Democratic candidate and the Pennsylvania Lieutenant Governor, John Fetterman. We are just now, remember, Fetterman suffered a stroke, essentially right before the primaries. His doctor, now hearing from his doctor, saying that Fetterman has had an AFib, has something called cardiomyopathy, a heart disease that makes it harder for the heart to pump blood. He says in 2017, he first checked out the Lieutenant Governor, John Fetterman, had prescribed medications along with improved diet and exercise and asked him to follow up again, and then adds Fetterman did not go to any doctor for 5 years and did not continue taking his medication. We are also hearing from Lieutenant Governor himself in a statement saying, I didn't do what the doctor told me, but I won't make that mistake again. He says, I should have taken my health more seriously. I want to bring in now our NBCNews.com senior national digital reporter, John Allen, who is joining us here, along with NBC News senior political editor, Mark Murray. So this is sort of a very interesting letter, I think, John, being released from the campaign, we should say. And Fetterman is extremely candid about the fact that, as he says, he should have taken his health more seriously, as there are questions now. He's been off the campaign trail since right before the primary, since he had that stroke. And what the prognosis is here. Here's what his doctor says. If he takes his medications, eats healthy and exercises, he'll be fine. He says if he does what I've told him to do, and I do think he's taking his recovery seriously this time, he should be able to campaign and serve in the Senate without any problem. So you couldn't call it a bill of good health, right, John? It's almost like a caveated bill that if he does X, he will be able to do X.
I mean, certainly you've got Dr. Ramesh Chandra here saying that if my patient does the thing he hasn't done for the last 5 years, he should be able to serve. I think another interesting piece of this is that Fetterman says in his press release that he's not going to be back on the campaign trail the way that he was before the primary for some time, as he's focused on his recovery. Earlier this week, NBC reported myself, Sahil Kapoor, and Henry Gomez that Democrats in the state were very nervous about what they said was a lack of transparency about his health care, which, of course, now there is this transparency, and whether he was going to be healthy going forward.
It's Mark Murray, a remarkably sort of candid assessment from Fetterman on his own. I think you could call them shortcomings as it related to the way he was taking care of himself previously. He says, it's frustrating, all the more so because this is my own fault. He says, but bear with me, I need a little more time. He says, I'm not back to 100% yet, but I'm getting closer every day.
And Hallie, he ended up saying that he almost could have died, too. And so there is a story in here on one of, hey, I ended up neglecting my health care like so many Americans, and I'm in shape. I'm watching what I eat. I am and exercising. I'm taking things seriously. That becomes incredibly relatable for a lot of Americans. I actually remember when Mike Huckabee was running for president in the 2007-2008 cycle. He was always talking about that. But on the other hand, is what John was just talking about in the great article that he ended up writing, kind of the lack of transparency here about the severity of it, not hearing from a doctor. When he ended up having his stroke, Hallie, it was 22 days ago. And so this has been a very long time, and arguably the top Senate contest that we are all going to be covering that could decide the control of the United States Senate. And Hallie, also, as you do know very well, covering campaigns, as I do, and John, covering a campaign, running on a campaign is a very stressful endeavor.